Hi all, back with medical surgical nursing genitourinary system pylonephritis. Now this condition you have to go and review a anatomy physiology first, okay? Then only you will understand this condition. Pylonephritis, it's an infection inflammation of the inflammation of the renal pelvis and renal parenchyma. Okay, which is a bacterial infection, and this infection is spread through the bladder. Okay, fine. Etiology: any trauma, any bacterial infection, okay, any malignancy is spread. Okay, then hydronephrosis, extra urine in the kidney. Fine. Risk factors we can say due to catheterization, cystoscopy, prostate enlargement, okay, sexual intercourse, cystitis, undescended testis. Because of that, we'll be doing circumcision. Okay, so uncircumcised male for these people and all, hydronephritis is mostly seen. Fine. So there are two types, acute and chronic. For acute, as we know, it is a bacterial infection. In acute, it is getting contaminated in the urethra. Okay, so we can say it may be because of any cystoscopy and catheterization. Usually acute pyelonephritis is occurring. Okay, and it can be seen only for few weeks. I can say 1 to 2 weeks. Okay, then chronic pyelonephritis is recurrent pyelonephritis. Recurrent acute pyelonephritis can cause chronic pyelonephritis. Okay, because of this, what happens is like there will be having chronic disorders which is affecting both kidney. Okay, now we are moving on with the pathophysiology. Pathophysiology is like due to etiological factor. Okay, bacteria is spreading through the kidney through the ascending urethra. Bacteria enters the kidney. Now when the bacteria enters the kidney, there is an obstruction formed, and because of that obstruction, urine is backflowing to the kidney. Okay, because of that, bacteria enters into the renal pelvis. Inflammation occurs, fibrosis is scar tissue. Okay, because of that, tubular reabsorption, I think so, in glomerular filtration rate and all, Bowman's capsule and all is there, right? In that, altered tubular reabsorption, that the tube is not able to reabsorb properly, or the kidney is not able to function properly. Because of that, it is ending up in signs and symptoms. Okay, I repeat the pathophysiology. Due to etiological factor, okay, bacteria enters the urethra. Okay, from there the bacteria is entering the renal pelvis, which is getting affected the urine, and the urine is getting obstructed. Okay, once the urine is getting obstructed, this bacteria enters the renal pelvis, and their swelling, inflammation occurs. Because of that, scar tissue is formed. Scar tissue is otherwise known as fibrosis. Because of that, the tubular reabsorption is getting altered and ending up in signs and symptoms. Okay, clinical manifestation is like enlarged kidney, because urine is backflow is there, no, so your kidney is getting dilated. Muscle pain or flank pain will be there. Okay, either in the affected side or on the both side, flank pain. Okay, then pyuria, anemia, okay, proteinuria, okay, then azotemia. Azotemia is an increased level of nitrogen, urea, creatinine in blood. Okay, then moving on with the diagnostic evaluation, history collection, physical examination will be done. Okay, then CT, USG, X-ray, KUB X-ray. Okay, these are the diagnostic evaluations. Management, it's according to the type. We have discussed two types, acute and chronic. So acute pyelonephritis, we will be giving sulfonamides. Okay, sulfonamides is a prophylactic antibiotic. Okay, so sulfonamides will be given commonly for 1 to 2 weeks. Because it's acute will be there only for 2 weeks. Okay, in chronic we will be giving antibiotics, that is ciprofloxacin, okay, or we can say ceftriaxone, okay, and antihypertensive drugs, acidosis drugs. Okay, then perineal hygiene, we will ask the patient to maintain a perineal hygiene. Okay, surgical management will be done if the obstruction is very much heavy, like a stricture we can, urinary stricture and all, if it is present, we will be inserting a stent and we will be dilating it so that the obstruction gets overruled. Okay, I hope you all understood. So today we have discussed about pyelonephritis. Pyelonephritis is an infection, inflammation of the renal pelvis and renal parenchyma. Okay, it is a bacterial infection which is spreading to the bladder. Fine. Etiology: trauma, malignancy, pregnancy. Okay, hydronephrosis, extra urine in the kidney. And risk factor: anything, catheterization, enlarged prostate, cystoscopy, etc. Types are two types: acute and chronic. Acute means 1 to 2 weeks it will be there. It can be due to any instrument insertion such as for catheterization and cystoscopy. Okay. Then chronic pyelonephritis is like recurrent. Acute pyelonephritis is ending up in chronic pyelonephritis. Due to etiological factor, what happens is like bacteria enters the kidney through the bladder. Because of that, obstruction occurs. Bacteria enters the renal pelvis and it occurs inflammation, infection, swelling. Okay, and which is ending up in fibrosis, and that is ending up in altered tubular reabsorption signs and symptoms. Fine. Clinical manifestation: cystitis, pyuria, hematuria, proteinuria, enlarged your kidney. Okay, mainly azotemia. Azotemia means increased nitrogen urine and nitrogen and urea creatinine in the blood. Fine. So management: acute pyelonephritis, we will be giving prophylactic antibiotic therapy, that is sulfonamides, 1 to 2 weeks. Okay. Then for chronic pyelonephritis, we will be giving antibiotics, that is ciprofloxacin. Okay. Then surgical management, like to relieve the obstruction, we will be inserting a stent to dilate the obstruction. I hope you all understood this. Fine. Thank you. Take care.